Hyoscyamine is a medication used to treat a range of stomach and intestinal issues, including cramps and irritable bowel syndrome. It is also effective for bladder and bowel control problems, cramping pain caused by kidney stones and gallstones, and Parkinson's disease. Additionally, it can help decrease side effects of certain medications and insecticides. This medication works by reducing acid production in the stomach, slowing down the natural movements of the gut, and relaxing muscles in various organs. It also helps to decrease the amount of certain body fluids, such as saliva and sweat. It belongs to a class of drugs known as anticholinergics/antispasmodics. The recommended daily dosage and optimal timing for taking Symax-Sl Tablet, Sublingual is usually determined by a healthcare professional based on individual needs and medical condition. It is important to follow their instructions and not exceed the prescribed dosage. When taking Symax-Sl Tablet, Sublingual, simply place it under your tongue and let it dissolve. You can also swallow it whole or chew it. It can be taken with or without meals, as directed by your doctor. The dosage will depend on your medical condition and how you respond to the treatment. It's important not to increase your dose or take it more often than prescribed without consulting your doctor. For adults and children 12 years and older, the recommended maximum dose is 1.5 mg in 24 hours. For children aged 2 to 12 years, the maximum dose is 0.75 mg in 24 hours. Be sure to ask your doctor or pharmacist for more information. If you take antacids, it's important to know that they can lower the absorption of hyoscyamine. To avoid this, take antacids after meals and take hyoscyamine before meals, or take antacids at least 1 hour after taking hyoscyamine. Make sure to drink plenty of fluids while taking this medication, unless your doctor tells you otherwise. And if your condition persists or gets worse, be sure to inform your doctor. Some common side effects of Symax-Sl Tablet, Sublingual include dizziness, drowsiness, blurred vision, dry mouth, headache, trouble sleeping, constipation, flushing, dry skin, and decreased sweating. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, fast/irregular heartbeat, difficulty urinating, decreased sexual ability, loss of coordination, trouble speaking, or vomiting. Seek medical help right away if you experience very serious side effects, such as eye pain/swelling/redness, or vision changes. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Symax-Sl Tablet, Sublingual, make sure to inform your doctor or pharmacist if you have any allergies to hyoscyamine or atropine. It's important to disclose your medical history, especially if you have a history of glaucoma, enlarged prostate, urinary blockage, stomach/intestinal problems, overactive thyroid, heart issues, high blood pressure, kidney disease, heartburn problems, certain nervous system problems, or myasthenia gravis. If you wear contact lenses, you may need to use wetting eye drops as this medication can cause dry eyes. Symax-Sl Tablet, Sublingual can make you feel dizzy, drowsy, or cause blurred vision. It's important to avoid alcohol, marijuana, and activities that require alertness or clear vision until you know how this medication affects you. Also, be sure to talk to your doctor if you are using marijuana. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. It's important to be cautious in hot weather, saunas, and during exercise or strenuous activity, as this medication may increase the risk for heatstroke by decreasing sweating. For older adults, there is an increased sensitivity to the side effects of this medication, such as confusion, drowsiness, excitement, constipation, and difficulty urinating. This can also increase the risk of falling. Children may also be more sensitive to the side effects. If you are pregnant, Symax-Sl Tablet, sublingual should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. Additionally, this drug passes into breast milk, so consult your doctor before breastfeeding. Now let's talk about how to use Symax-Sl Tablet, sublingual. Before taking this medication, it's important to be aware of any potential drug interactions that could affect how it works or increase the risk of serious side effects. It's a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Symax-Sl Tablet, sublingual include certain azole antifungal drugs, bisphosphonate drugs, corticosteroids, digoxin, potassium tablets/capsules, and pramlintide. Also, be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. You should also check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's important to note that this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are using this drug. Now, let's talk about the daily dosage and optimal timing for taking Symax-Sl Tablet, sublingual. Be sure to follow your doctor's instructions carefully and ask your pharmacist about using this medication safely. If someone has taken too much Symax-Sl Tablet and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include hot and dry skin, fever, unusual excitement, fast or irregular heartbeat, and seizures. It's important to get help right away if you suspect an overdose. It's important not to share this medication with others. If you're taking Symax-Sl Tablet for digestive disorders, you may also need to make some lifestyle changes to help it work better. This could include things like reducing stress, getting more exercise, quitting smoking, and making changes to your diet. Be sure to talk to your doctor or pharmacist about any lifestyle changes that could help you get the most benefit from this medication. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take 2 doses at once to make up for the missed one. It's important to store Symax-Sl Tablet, sublingual at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposal, make sure not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.